In India, hospital fires have become a very alarming issue. Several incidents have been reported through the years, resulting in devastating loss of lives and property. According to recent studies, research papers, and the investigations, the major cause of the fire incident is the oxygen enrichment, electrical faults, and non-compliance with the safety standards. These are the significant factors causing these fire mishaps, especially in the intensive care units and the neonatal intensive care units of the hospitals. Let's start to understand everything in detail. What are the factors causing frequent fire accidents in hospitals? Why has no action or measure been taken to tackle these incidents? And lastly, some measures to prevent it from happening in future. Hello and welcome. This is Akanksha and you're watching HW News English. The key factor for fire is an oxygen-enriched environment, which is commonly found in the ICUs. The high rate of oxygen heightens the risk of fire, combined with sparks from electrical devices or any heat sources. According to the study, this serves as a primary cause of hospital fires. Other factors include the medical equipments like the split air conditioners and the ventilators, which are very essential for the patients. These often become ignition points due to the poor maintenance of the equipment and outdated or old electrical systems. In India, the minimum requirement for reasonable degree of safety from fire emergency departments in the hospital focus on the design, infrastructure, and construction. Items that minimize the possibility of fires, provision of detection, alarm, fire extinguishment, fire prevention. There are several planning and training programs as well for isolation of fire and transfer of occupants to a safer place. Furthermore, a comprehensive evaluation of over 2 lakh public healthcare facilities by the Indian government revealed alarming deficiencies. According to the Indian Public Health Standards Dashboard, only 20% of India's medical facilities meet the required standards for infrastructure, equipment, and personnel. And shockingly, 42% of the hospitals have scored below 50, exposing the inadequacies and safety lapses in the medical care institutions. In addition to the oxygen-rich environment, electrical malfunctions remain a major contributor to hospital fires. According to research, old, poorly insulated wires, overloaded circuits, and unmaintained equipment are still used in many hospitals in India. Reports suggest that during the COVID-19 pandemic, when the healthcare systems were overstretched beyond their limits, fire incidents surged to a higher rate compared to the past. The Indian Express examined over 11 major fires, out of which 8 were linked to the short circuits caused by improper maintenance. For instance, a fire broke out at Prince Bijay Singh Memorial Men's Hospital in Bikaner. It was triggered by old and overloaded electrical wires. Similarly, in Maharashtra's Vijay Vallabh Hospital lacked functional sprinklers and its air conditioning system running beyond capacity caused a spark leading to the fire. The national capital, Delhi, witnessed over 66 hospital fires in the span of 2 years. This includes a tragic blaze in May 2024 that killed over 7 newborns in a neonatal hospital, which was operating with an expired license. Further investigations also revealed that an absence of qualified doctors present in the hospital, lack of fire safety equipment, and regulatory clearances. 2 weeks ago in Jhansi, Maharani Lakshmi Bai Medical College, fire claimed the lives of over 18 newborn babies, and the suspicion was a short circuit. These repeated tragedies highlight a series of systematic issues, that is, expired fire certificates, lack of compartmentation, inadequate firefighting equipment, and poorly trained staff. Now let's discuss the 5 most devastating hospital fire incidents. The 2011 fire at AMRI Hospital in Kolkata. AMRI Hospital fire in Kolkata stands as one of the deadliest and worst hospital fires in India, as it claimed over 90 lives. Shockingly, the fire broke out because flammable materials were stored illegally in the basement of the hospital. These materials caught fire due to an electrical short circuit. Further adding to the trouble, the hospital's fire extinguishers and the sprinkler system were non-functional, and the emergency exits were inaccessible. Several patients and staff were trapped inside, leading to fatalities and the primary cause being suffocation. The 2016 Murshidabad Medical College and Hospital fire in West Bengal. The fire at Murshidabad Medical College and Hospital claimed at least 50 lives. The blaze was triggered again by a short circuit, but this time in an air conditioner. The situation got critical as the hospital's main emergency exit door was locked, trapping the patients and the staff inside. Absence of functional firefighting equipment was also reported from the hospital. The 2016 SUM hospital fire in Bhubaneswar. The fire in SUM hospital resulted in over 22 deaths and once again caused by a short circuit. Further investigations into the matter revealed that the hospital had not obtained a mandatory fire no objection certificate. The lack of basic firefighting equipment and inadequate emergency preparedness led to the high death toll. The 2021 Patel Welfare Hospital fire in Gujarat. In this incident, a total of 18 lives were lost, including 2 nurses. An inquiry commission led by retired Justice D.A. Mehta found that the hospital management had submitted false records to show compliance with fire safety norms. The hospital had no functional firefighting system or equipment. The fire was caused by loose wire from again a ventilator, which reflects a lack of regular maintenance issues. The 2024 Baby Care Newborn Hospital, Delhi. A fire at Baby Care Newborn Hospital in Delhi led to the death of 6 newborn babies. The hospital lacked basic fire safety equipment and its occupancy exceeded sanction limits. Furthermore, the oxygen cylinders were stored hazardously with no safety guidelines. Now let's try to understand what challenges the firefighters face while saving the lives during such difficult times. According to a report from Economic Times, the hospital fires present a unique challenge for the firefighters. Evacuating patients, particularly those in critical care or children's ward, requires meticulous planning. A proper coordination with hospital staff who are aware of the building's structure and all the emergency exit doors. Firefighters often face infrastructure limitations such as narrow staircases that hinder their rescue efforts. For example, in Delhi's Vivek Vihar fire, the firefighters had to rely on ladders to rescue trapped infants. The firefighters could not enter the hospital through main doors due to the narrow and faulty stairs, which again underscores the need of improved evacuation planning and infrastructure of hospitals. Now that we have already discussed the factors and the difficulties faced by the firefighters, let's take a look at the accountability. While speaking to Times of India, Adil Garg, director of Delhi Fire Service, described hospital fires as one of the most demanding challenges faced by the department. He said, responding to hospital fires requires additional personnel and time to evacuate the patients while simultaneously fighting the flames. According to a recent study, accountability for hospital fires remain elusive. Most of the accused in the major fire incidents have been granted bail. In some instances, the court cases are dragged for over years. In other cases, hospital owners and the doctors continue to practice and manage facilities despite the pending charges. Investigations also reveal that safety measures are often implemented just to secure operational licenses, with no proper follow-up to ensure the compliance. Now let's discuss on what are the safety measures that can be taken to curb such incidents from occurring in future. In order to mitigate the risk of fires, Indian hospitals must adopt stringent safety measures aligned with the international standards. These measures are prescribed by the National Fire Protection Association. Firstly, an upgrade in infrastructure. Compartmentation using fire-resistant materials can be very helpful, along with wider staircases for easy evacuation. Timely and regular maintenance. Periodically getting your electrical systems and equipments inspected. Discarding old and faulty wires can also help to prevent short circuits. Availability of adequate fire and fighting equipments in the hospital. All hospitals should install sprinklers, alarms and extinguishers to ensure that they remain functional. Lastly, conducting fire training sessions for all the employees and staff working in the hospital. Comprehensive fire safety training for hospital staff and the administrators. A 2020 study published in the International Journal of Community Medicine and Public Health found that 78% of the 33 analyzed fire mishaps in Indian hospitals between 2010 and 2019 were happened due to short circuits and electrical short circuits or similar problems. A majority of these mishaps happened in government hospitals. The increasing frequency of the hospital fires in India is very concerning. All these tragedies serve as a grim picture and demand accountability of those who are responsible. It also highlights the need of systematic reform in India's hospital and healthcare sectors. Addressing infrastructure lapses, ensuring regular maintenance, and holding negligent parties accountable are crucial steps to ensure safety of the patients. That's all for this news report. Do let us know what are your thoughts on this report. Until then, keep watching HW News English and download our app HW News Shorts for the latest news and updates.
Stay ahead with our cutting-edge news app. Instantly access the latest shorts in just 1 minute and breaking news in just 50 words. Download now for a smarter, faster news experience.